So another common question we get about rhinoplasty is, can it be done non-surgically? And as with a lot of procedures we do, there are more and more questions about non-surgical options. The simple answer is yes, there are some nice non-surgical ways to change the shape of a nose, but there are some very specific concerns that can be changed. Meaning, if someone comes in with a concern that their nose is too flat, we can certainly augment or increase the height of the nose using fillers, for example. We can use temporary ones to begin with, and then actually convert over to much longer lasting fillers to give a patient a long lasting result. So the idea is, if you've got a relatively flat nose or a tip that's not quite as defined, we can use fillers to make those kinds of enhancements. And sometimes, if there is a bump, we can even camouflage that bump by putting filler on either side of the bump to make for a nice straight line. Having said that, if the overall goal is to decrease the size of a nose, if you feel like the nose has got too large of a bump or too projected beyond the plane of the face, that's a situation where surgery is still the better option. So as in most cases, best thing to do is, of course, see a doctor, get a consultation in person where they can actually examine your nose and tell you if you're someone who would be better off with a non-surgical option or if surgery is still best for you. Hopefully that helps answer that question.